Hi everyone, thank you for tuning in. My name is Jennifer Dominic. I'm the founder of WeNight, and I'm also going to be your interviewer for today. For those of you watching this video for the first time, WeNight records career paths of people who either have a background in STEM or are currently working in a STEM related industry. Without any further ado, really excited for our guests. So let's get straight into it. Tell us about your current role and what you're currently doing.
Thank you, Jennifer. Nice to meet you and nice to be here and nice to be part of what WeNight is doing. It's very exciting to me, especially as I also mentor people here in Canada, specifically Nigerians in Canada, who are coming into the pharmaceutical and clinical research path. So yeah, currently I work as a clinical project manager, a clinical project lead actually. And so I manage regions, different regions of the world for a particular study. So I work for a CRO, I work for LabCorp, Laboratory Corporation of America. And what I do for them is ensure that the projects go on according to the time agreed with the client. There is no scope creep. So I'm basically a project manager as an IT project manager would be, but with a great and deep understanding of clinical operations. So that helps me relate to the sponsor in terms of what are the timelines of working with, what is the scope of the study, ensure that there's quality achieved in the study, ensure that the risks are properly assessed, identified, assessed, and mitigated early on, as well as ensure that my resourcing is, up to speed. My budget is aligned every now and then, every month usually. So that's what I do for LabCorp at the moment.
That sounds exciting. So maybe let's dig in a little bit more and let's talk about what a week, or choose a week in the calendar in the last couple of months or any 2 weeks, and tell us what you had to do. What did your diary look like?
Right. So this particular week is a hectic finance week at LabCorp, where we're ensuring that I'm invoicing correctly to my clients, and I'm forecasting correctly for what the months ahead would be like. And that's for the finance side of things. So generally in my schedule, or I would say in a week, I meet with my cross-functional team. And this is where you have different people in there that are SMEs, subject matter experts in their field that are working for you. Usually in the clinical research cycle, the cross-functional team you would have are the operational lead, the regulatory lead, the startup lead, depending on how big the project is. You have the startup lead, you have the PMs for the other regions. So like I said earlier on, I manage the whole world for this trial. So I have a PM for APAC, I have a PM for Europe and Australia, and I have I double as the PM for Canada and the US, so Northern America, as well as the PM lead. So I would have all the PMs on the call, I would have the safety lead on the call, depending on the study, I would have the data manager lead, but for this study, I'm not contracted for data management, so I do not have the data manager lead on. So I would also have sometimes the study startup, depending on how the critical part of the study, I would have the contract lead, because that's a critical part that I'm currently facing on my study. So I would meet with them and just review what are the actions for the internal team, because they need to speak to each other, even though they have been speaking to each other, maybe things they need to escalate to me, and I probably can drive or, manage at that moment. And then I would move on to, do you have anything to escalate to the sponsor? Is there anything holding your goals being met? I would review the timelines with them and most likely review what they have spent, their burning hours, to let them know, hey, we're either good with resourcing and finances, or we're not. And this is what you need to do. You need to stop burning time. What are the issues? Do we need to highlight a change in scope to the client, or are we good with that? So that's like my very first typical task for the week, which is meeting up with my functional team. And then sometimes this is my personal style, I still do a one-on-one, because during the call, there's just the general, what do we want XYZ to do for us within the team, but I need to know, do you have any specific issues, especially, excuse me, if it's that critical part that I'm working with at the study. So like we know that we have the study stop, we have the current monitoring, and then we have the closeout. So at this stage in my study, I feel that startup needs a lot of focus. So I would still have meetup, and I have been able to move some of the things I learned as a project manager, even to the clinical trial industry, where I do stand-ups, 50-minute stand-up with my study startup team to ensure that I know what's the highlight, what's the issue, especially if it's a critical part in my timeline at the moment. So that's like team meetings and resourcing. And then I go to the finances. I review the financing every week. What's the forecast like? Are people on, are they what they forecasted, does it make sense that this is what we're going to use during this month? And then what are we invoicing the client? Is this what we actually used for the previous month? And then I also try to forecast for the company, because we have like a company-wide forecast where we see like, are we actually doing well with our numbers? And then I go into the scope, managing the RACI, and just trying to align that everything that we said we will contract for the client, we are actually doing. What do I need to put to my priority list right now? What do I need to move to the front of what we're doing right now in the whole highlight of the study? And then I review the risks, any risks that has been highlighted during the calls with the client or calls with the team. I review them to make sure that we are actually working to mitigate that, proactively. And then we have the quality, which has to do with the documentation and all that, just trying to ensure that I remind my team, if there are any errors in my documentation system, my TMF, my Viva Vault, ensure that I review that with them. And if they have any issues with accesses or issues with, training and all that, and make sure that that's done. So yeah, typical week in my life.
You also mentioned that you manage project managers within Northern America and then in other regions as well. You mentioned hack. So what's your setup? Where are you based? And how does that allow you to be able to work with people from regions around the world, from someone who might not understand how a global company works?
Right. So I'm based in Ontario in Canada. So we're in the Eastern time zone, and so I have a study all the way in Japan, and definitely there are different challenges that poses with us in terms of the way things are done, as well as the time zone. So what I do is, like I said, apart from meeting with everyone, I do have like one-on-one. So sometimes I am here late at 8 p.m. EST trying to catch up with my Japan counterpart. I believe it's win-win. Sometimes she's up till 9 p.m. at time to catch up with me when I do like early morning 8 a.m. calls or 7 a.m. calls with her. So, we've always had to, like, what do you call it? Win-win. So sometimes, she would be the one to bend. Sometimes I would be the one to bend. So the challenges, I would say instant time zone is a very, very fantastic time zone to manage things globally. And I find out that a lot of recruiters look for people within EST, specifically because we can still cross to, say, Australia, we can still cross to Japan. So when they have like 8 p.m. calls, I'm still, it's not too bad for me. I typically wouldn't work all straight till 8 p.m. I'll definitely take time off, have dinner with the family, take my boys for basketball or soccer, and I can be back by 8 and still, quickly log into, check up on her and, what's doing. Another thing I find that is very helpful for managing global work is collaborative tools like the shared documents on Google or Microsoft. So I'm usually like, okay, can you just highlight everything you have done in a tracker? So when we meet, it's not, I know you're probably sleepy or I'm sleepy, but we already know what we want to discuss. So it's a quick breeze rather than, right there, we just want to initiate. So the use of trackers have really helped me in managing my team across globally.
That's fantastic. Thank you for taking the time to break that down. I know that's a question that I'm based in the UK myself, and sometimes when I speak to university students and they're trying to understand the world of work, they try to understand, so what does it mean? Does that mean I can move to another country? How does someone from one country work with someone from a different country? And then now you're talking about regions. So it just helps to break it down a little bit. So that's super helpful. Thank you. Okay, so let's step back. How did you get to this particular role? What did you study? Did you always know this is something you wanted to do, or was there a particular path that you followed to kind of get to where you are now?
Fantastic question. So I studied biochemistry. I'm Nigerian. I went to University of Lagos, and I typically have a typical Nigerian home. So the goal was medicine. And during my fourth level in biochemistry, we had the DNA course, which it blew my mind. We just had this, discovery from Watson and Crick. So I was so intrigued, and I was like, you know what, I'm not going for medicine, because the plan was to do biochemistry and then, go back for medicine and all that. So I decided to do a master's in biotechnology. And during my master's in biotechnology, I got further involved in research. I got intrigued about why do things work this way. I want to find out what have people done about it. I want to dig deeper. And so I had my first job with GlaxoSmithKline, but I was in the lab, and we're trying to find out effect of, I think, antibiotics. There are antibiotics on certain bacteria. It was just an intriguing time for me, and I said, this is really what I want to do. And then I was based out of the UK, and so I said, what, I'm going to come back to Nigeria. I was going to fight malaria. We had this very big dream. So I'm coming back to Nigeria, and I called GSK because I knew they were doing some work in malaria research. But that was the first time I really landed my feet into clinical research, because we were not developed enough to actually do like the laboratory research as in much depth. But we were going to be doing the clinical trials of the malaria vaccine that had been discovered then in humans. So that was my first inclination to clinical research. That was how I landed in the pod. I just wanted to do malaria research, and the availability was clinical research. And after it was almost 7-month interview. It was an interesting part for me. I got the job with GSK, and GSK Nigeria trained me to the teeth. Like, that was my very first orientation to clinical research. I did fantastic training, and I became a clinical research associate and an established monitor. So I did that for about 3 years, and I took about a 4-year break to be with my family, to have my kids and all of that. And one of the investigators I worked with actually invited me to continue lecturing with him in the teaching hospital where I did my first pediatric research. And during my time there, I found out that I was still being pulled to clinical research, because people would say, you have the background in good clinical practice, you understand how the regulations work, you understand the submission guidelines, you understand how to prepare the dossiers for submission, and you understand how to develop protocols. Do you want to come and help me on my study? You understand budgeting. Do you want to come and help me on my study? So I found that I was still attracted to clinical research, even though I had gone into the academic stream back after my maternity leave. So that spurred me to say, you know what, I want to take this back on fully. And I want to also get very involved into operations as well as the science of clinical research. Because if you notice, most of what I mentioned on my everyday work, I didn't mention anything science, but my science background has helped me to go that far. So I moved to Northern America, and I, started with IQVIA, and I've just moved up the ranks to and more into operations management. And I found that I was, apart from naturally a project manager, I could easily adapt those skills. And I could also work from home, which I needed at this time with my kids growing up. So that just worked as a win-win for me. And I grew up, and I got this job at LabCorp.
Wow, what a journey. So you worked across so we've got Nigeria, we've got the UK, and then we've also got Canada, where you're based now. So right. In IQVIA, were you also based in Canada as well?
Yes, I was based in Canada. Yeah. And so I've moved, actually. I've moved around a lot. I've worked with Roche in between, and my journey has really helped me interact a lot with a lot of people, understand the industry more. So I've actually got a good share of, each aspect of clinical research in project management. So it gives me a very robust experience.
Yeah, that's interesting. Very, very exciting. So with all that experience and working across different borders, you've clearly worked across different healthcare systems as well. How have you found the importance of diversity and inclusion in your own journey? How has it helped you, and maybe how have you helped others as well?
So that is a fantastic question. And I would say that one of the things that we always must not forget as scientists is we do not do anything until we have good evidence, right? And this for me is a mantra that I work with. So we keep searching, we keep asking until we have enough data to say this is what we're going to do, right? So you just having, say, clinical trials in one aspect of the world doesn't give you sufficient evidence to sell that drug or use that drug in another side of the world. So I have seen that companies moving to have more inclusion of more countries in clinical trials really have more data and definitely more evidence of their drugs being active or more efficacious within different populations, and definitely more wins for them. And for me, working in the sector, it's been exciting to actually see that I understand more regions, because it helps me, break down the operational aspect of things. So understanding how they want to submit their trials. And in Japan, if you do a PSV and you're no longer going on with the site, you have to do an apology visit. It's helped me. It's definitely a win when you actually include more countries and therefore include more people. So having someone who is Japanese on my team really helps me understand Japan very, very much, and helps me understand their requirements and work with them. And then it now moves back to me being African and me trying to work with different studies or different populations or different countries that, in Africa or, have the needs. It's helped me embrace working with different people, and of course encouraging my team to employ people from Africa and employ people from various backgrounds, because then you can work easily in their countries. For me personally, it has been helpful to see a lot of women work in the industry. That is definitely a booster. When I get on my calls and I find out that, oh, this woman, I'm like on project management calls and I'm seeing like women with kids and all that. I'm like, oh, they can do it. I definitely can do it. And like, how long have you been on this? Like 20 years. I'm like, oh, and talk about their kids, talk about the hockey games and all that. So that's definitely a win. And then for my color, joining groups like WOSIP and all that, it it's the representation just helps you mentally see that, oh, this is the next thing I can do, you know. I don't have to stay on the analyst level. I can be a manager. You mean I can do this? You mean even though they have to cook those long Nigerian meals, they still have the time to manage their home as well as manage this important project? That means it's going to be easy for me. So it helps me, you know, I can relate, and it helps me build my vision personally that I can do more, I can be more, because I see women doing that, or people that are like me doing that.
That's amazing. That's really inspirational. And a shout out to WOSIP as well, because that's
how
we were able to meet each other. And this is how you've been able to extend that help to others by sharing your story. With that, maybe another question I'll just ask is, as you share this video and as you sort of share your career path, is there anything you've not already mentioned that you want someone to take away from your story?
Thank you so much, Jennifer. There's one thing I need to mention before I mention that. So when I came to Canada and I realized that it was, you know, it was difficult for people to integrate, especially from their Nigerian background and experience and education, I founded Nigerians in Clinical Research and Pharmaceuticals in Canada. And it's been an amazing journey to see over 60 people get their footing and placement in the industry, either from their backgrounds in science or their backgrounds in data or their backgrounds in the pharma and medical industry. So I want to say that's one thing I'm doing, and I'm so excited about it. We recently had a new director, because I've gone back to school, so there's someone directing it right now who's very passionate about it and really trying to institutionalize it and help more people get into that. So it's something I'm always excited to do, and mentor people to come into the industry, because the industry definitely is big and it's wide. So the last thing I would want to say to people is, I always tell people, I don't think I'm 100% smart. Like, I mean, you know one or two things, right? You're listening, but I think I'm always I'm in the space. So I'm out there, I'm visible, right? I'm visible and I am prepared. So I tell people, yes, you may not have all the answers, but keep learning and keep being visible. Let people know what you're doing, even though it's a journey. I don't have it all sorted out, but I'm visible and I am prepared. So when people ask me questions, I really know, like, you know, the three basic things I do, or I can summarize everything I am in 3 pointers. So that really would help you in like interviews, or, you know, getting to the next step, or having conversations with people that will definitely move you to the next step.
Thank you. So you're already doing this in so many different ways. You're continuing to be visible by helping others, by talking to me, by helping me, you know, through sharing your story on this profile as well, and also encouraging people about storytelling, which I also advocate is an amazing thing, to be able to know your elevator pitch and how to describe yourself in 3 key points, or 3. All right, so maybe the next thing is, with all this, of course you'll continue to push on with your support and encouragement for others, but what next for you?
Oh, wow. What's next for me? So one of the things I told myself I want to be known for in the next, say, 5 years is I want to be able to break down finance in project management, in clinical operations. So I have worked in almost, say, 3 CROs, and I find that as project managers, you still have financial analysts, you know, working with you, and you speak to a lot of project managers and like, oh, you know, the finance part, we're here and there on it. I want to be able to like get to the business acumen side and like get finance, break it down, and really push my company or push my study to actually have a favorable financial statement. I mean, it's definitely, it's helping people, so I don't want to take that part from it, but I also I'm responsible to ensure that, my company is actually doing well with the books so that we can keep on being a company, right? So that's one thing I intend to do career-wise. Another thing I intend to do is really be a champion for encouraging more trials amongst minorities. I haven't been able to keep a key on what aspect I'll be doing in that definitely, but definitely it's something I'm doing, how to encourage more trials, either in countries that are regarded as underdeveloped or third world countries, or amongst minority population.
That's amazing. You also mentioned that you're studying again, actually.
I am.
Does that have anything to do with the financial part?
No, it has more to do with the science and how to encourage, have more methodology to help more minorities be involved in trials. So that's,
okay,
yeah.
so that's to do with the trials part. So we will see something coming up. So at least have a record in time that will be out there, and then we can refer back to this video in the future and see how both of those things go.
Yeah.
And you'll probably smash the 5-year target and doing it for 1 or 2 years.
That would be interesting. That would be interesting.
So is there anything else that we haven't covered that you think would be important to share with our viewers?
Yeah, so I stumbled across a document I wrote exactly 5 years ago. No, 6 years ago, and it was about trying to reach out to high school students, middle school and high school, I believe, and tell them more about health research. Because I mean, I'm Nigerian. A lot of things have changed definitely in the last 20 years. But if you had asked me what I wanted to do, I'll either tell you I'm going to be a doctor, and I'm going to be a lawyer, an architect, an engineer, and things like that. But I think it's time, and to do a lot of mentoring for the younger ones, to help them know, especially middle school, high school, to help them know that this exists. And I know COVID came to really help shine light on clinical research, but it's something that I'd really love to do. I stumbled on this document and I was like, oh wow, because I actually went to schools, and I was hoping I could get a lot of calls to speak to them, because I really wanted to share. So it's something I would like to do. It's something I would encourage everyone listening that is actually in this journey already to do, because there's no way we're going to continue to understand. Like I said like I said earlier on, we can't do a lot until we have good evidence to work with, and especially with like the drugs and medications we use, we need to do more research on them in our population. And until we actually have the workforce to do that, we wouldn't be able to achieve that. So I try to encourage people to join this journey and this career path.
Thank you so much for taking the time to share that, to share those perspectives. I hope others are inspired. I certainly am. So with that, I'll take the opportunity to bring us to a close for this conversation. And if you really enjoyed this video, I suggest that you drop a comment, and you subscribe. And you can also check out a couple of other videos that might also refer to jobs in the pharmaceutical industry and perhaps in clinical research. And if you really want to learn more, you can also reach out to us by email as well, and we can see about getting you connected with Funlayo. So I'll stop there.
Thank you.